Well, after battling COVID-19, many survivors are now saddled with massive medical bills.
One woman in South Florida estimates she's now $100,000 in debt from several hospital stays. I-Team reporter Danielle Wall has her story tonight and information about the federal program few people know about set up to help these survivors.
It was just a very unlucky set of circumstances for me.
Trisha Sales was just days away from qualifying for health insurance when the waitress was laid off due to COVID-19 closures. The uninsured Broward County woman then got a bad case of COVID-19. Several hospital visits later, she's now $100,000 in debt. Months later, she's still struggling with COVID-19 symptoms, and the collections calls are starting.
I can't handle this right now, because I'm so overwhelmed with the amount and still trying to get better.
But there is hope for those facing high COVID medical costs.
The Provider Relief Fund is reimbursing healthcare providers at Medicare rates for the care they are providing to uninsured COVID-19 patients.
In this video, Secretary of Health and Human Services Alex Azar explains part of the Federal CARES Act set aside $175 billion for a provider relief fund meant to pay for COVID-related medical bills, even for the uninsured. The legislation puts the burden on the provider to file a claim and get reimbursed for these bills.
Nobody has told you about this fund.
No, I've never heard of that before. What's it called?
The Provider Relief Fund.
Most people don't sit around and read legislation. Let's face it.
Jody Ray is the director of Florida Covering Kids and Families, which helps Floridians get access to health insurance. She says many people don't know about the Provider Relief Fund, and it's a big problem.
We want that to get out. We need people to know if you got bills related to COVID, you need to go back to your provider and you need to tell them that you know that this fund exists.
Ray worries the uninsured will be reluctant to seek medical treatment for COVID if they don't know about their options. As Trisha experiences new and serious symptoms, she says she doesn't know if she'll follow her doctor's orders and go back to the ER.
I cringe every time they try to register me when I'm there. I'm like, do they see how much money I owe them? And that I don't have insurance. Are they going to, give me proper care?
We reached out to members of our congressional delegation who co-sponsored the CARES Act, and we heard back from Congressman Brian Mast. He says people dealing with these COVID-related medical bills can contact his office for assistance. In West Palm Beach, Danielle Waugh, CBS 12 News.